Let me take this opportunity to wish everybody a very happy holiday season and a wonderful new year. And what I wanted to discuss very briefly with you is the fact that I will soon be assuming the chairmanship of the U.S. Senate's Health, Education, Labor, and Pensions Committee, one of the most important committees in the Congress. And as I move into that position, which has very broad jurisdiction over many of the major issues facing our country, let me tell you what's on my mind and what kind of committee I would like to lead. And I also want at this moment to ask for your help, because in the final analysis, as I think most of you know, real change never comes from the top on down, not from Washington to the rest of the country. It always comes from the bottom on up, when millions of people at the grassroots level stand up and fight for what they need. But let me say a few words now about some of the issues that we will be dealing with. And let me start off with our dysfunctional healthcare system. And as I speak to you right now, I'm thinking about a nation that spends twice as much per capita on healthcare as the people of any other nation. We are spending some $13,000 for every man, woman, and child in this nation. That is an astronomical sum of money, and that is unsustainable. Meanwhile, we have worse healthcare outcomes than most other countries, including the fact that our life expectancy, how long we live, is lower than many other countries, despite the fact we spend so much more on healthcare. And of course, as all of you know, the reason for that is that the function of our healthcare system is not to guarantee healthcare to all people, but to make as much money as possible for the insurance companies. So in our country today, while the insurance companies make tens of billions of dollars a year in profit, we have 85 million Americans who are either uninsured or underinsured. We have almost 500,000 people every year who go bankrupt because of medically related expenses. And we have 60,000 people who die every year, if you can believe it, because they don't go to a doctor when they should. And if that's not a definition of a cruel and dysfunctional healthcare system, I don't know what is. Furthermore, we are living in a country today where drug companies are making huge profits while people split their life-saving pills in half because they can't afford them. And we have a situation today for elderly people where they can't afford to get the dental care they need, the hearing aids they need, the vision they need, because Medicare does not cover those very basic needs. And I can go on and on about healthcare, but the bottom line here is that what we have in this country is really disgraceful. And that is an issue together we are going to have to work on. We must have the courage to stand up to the greed and recklessness of the insurance companies and the drug companies. We have to substantially lower the cost of prescription drugs. And we have got to work to guarantee healthcare as a human right for all of our people, not a privilege. So that is a broad view of where I want to go on healthcare. Now, education is also within the jurisdiction of the Health, Education, Labor, and Pensions Committee. And today, when I think about education, I am thinking about a country where somehow or another we can afford to give massive tax breaks to the billionaire class, but meanwhile our teachers and our children exist in classrooms with broken chairs, flooded buildings, and inadequate staff support. And we're living in a country where many thousands of our teachers, and they are truly heroes and heroines, are inadequately paid as they do the best they can for the children of America. We're living in a country where hundreds of thousands of bright young people who have the desire to get a higher education, they can't do that because the cost of college and trade schools are very expensive and their families lack the money in order to pay those tuitions. And meanwhile, we have 45 million Americans who are now struggling with student debt. I'm thinking about a country today which has a wildly dysfunctional child care system. And any of you who have little kids, you know this. It costs on average over $15,000 a year to get a kid into a child care facility if you are lucky enough to find that slot available, because there are many parts of this country where it's very, very hard to find affordable, quality child care. So this issue of child care of pre-K is a major issue that we have got to work on, because these little kids are the future of our country, and we cannot continue to treat them and their parents the way we currently do. So yes, overall, we have got to work towards creating the best educated workforce in the world, one that prepares our kids to succeed in a highly competitive global economy, one that recognizes that a high-quality public education system from childhood to adulthood is the right of all and not just the privilege of a few. So education from childcare through graduate school is an issue we've got to focus on. We have to make it high quality, we have to respect educators, and we have to make sure that all of our people, regardless of income, can get the education that they need and deserve. When we talk about a health education labor committee, obviously the needs of working people is very much on my mind. And today I'm thinking about a very rigged economy with an unprecedented level of income and wealth inequality. And that means that the middle class continues to shrink while the people on top have never had it so good. And the gap between workers and their bosses is now wider than it's ever been. The employers, the bosses now earn about 400 times more than their workers make, while workers, millions of workers, are trying to exist on starvation wages. I'm thinking about a country today where at this moment, workers all across this country, at Starbucks, Amazon, nurses at hospitals, workers at factories, young people on college campuses, they are organizing unions in order to receive better wages and working conditions, because they know at the end of the day, unity, bringing people together for collective bargaining in a union is the only way that many workers are going to get the wages and benefits and working conditions that they desperately need. But what's going on in America today is that these efforts, where workers are exercising their constitutional rights to form a union, they are being vigorously resisted by fierce and illegal anti-union actions from corporate America, from Starbucks, from Amazon, and from many other powerful entities. They are doing everything they can to deny working people the right to form a union, and we've got to deal with that issue. So yes, we must raise the minimum wage to a living wage. Nobody in America is going to make it on $7.25 an hour, which is what the federal minimum wage is today. We must stand up to the extraordinary greed and power of corporate America and make it possible for workers to organize unions. Now, I am not naive. I didn't get into politics yesterday, and I do know a little bit about how the U.S. Senate and U.S. House work. So I am not here to tell you that all that has to happen is that I assume the chairmanship, I bang my gavel, and lo and behold, all these important pieces of legislation get passed. It ain't going to happen that way, that's for sure. There are going to be a number of issues where Republicans and some conservative Democrats, sadly enough, are just not going to be supportive, and I understand that. But that doesn't mean that we give up on these issues. We're going to take these issues to the people. We continue the fight. And if we can't pass these very important issues today, well, we're going to lay the groundwork for doing it tomorrow and into the future. But in addition to that, I am hopeful, and I believe there are some areas where we can find common ground and make some real progress with some Republicans and with some more conservative Democrats. For example, the truth of the matter is that whether you're a Republican or a Democrat or an independent, no matter what your ideology may be, you know what? You can't afford the outrageously high cost of prescription drugs and insulin. So I hope that we can bring people together to lower the cost of prescription drugs. It doesn't matter to me what your ideology is. If you're a working parent, you can't afford $15,000, $20,000 a year on childcare. And millions of people are just unable to afford to send their kids to college. So I hope that we can create some kind of consensus. It may not be everything I want, everything you want, but hopefully we can create some kind of consensus to improve the situation that exists in education from early childhood up to higher education. And the truth is that, I don't care what your ideology is. You could be a right-wing Republican or a democratic socialist. It could be whatever it may be. You ain't going to make it on very low minimum wages, and we're going to raise that minimum wage, as I said earlier. So hopefully, with a lot of work, it's not going to be easy, we can make some important progress on labor issues. We can make some important progress on educational issues, on healthcare issues. And that's what I want to do. I want to lead this committee in a way that brings forth some very concrete results for the American people. But this I do know, that for us to be successful, not only in my committee, but every other committee, the American people are going to have to stand up and fight for their rights. And I hope to take this committee, and I myself, around the country. We're going to do a lot of hearings, for example, in Washington, D.C. It's a very nice committee room. But we're also going to take the committee out on the road. I think it's important to hear from working people themselves and what their struggles are about. I think it's important to hear from elderly people and what's going on in terms of their ability to purchase prescription drugs or to try to get by on Social Security benefits, which often are just not enough. I think it's important to hear from young people about the high cost of college or about their student debts. So that's where I need your help. Whether you are in a blue state, whether you're in a purple state, whether you're in a red state, we have got to make it clear to the U.S. Congress, to the President of the United States, that this country needs jobs that pay working people a living wage. No more starvation wage jobs. We need health care for all. We need to expand primary health care to parts of the country where it's just very hard for people to come by a doctor, to get a doctor, even if you have insurance. We have got to lower the outrageous price of prescription drugs. And we have got to create educational opportunities for everybody. So my point here is that I need your help. I need your help to stand up with me. I need your help in telling me what the issues are in your communities. That's the only way I can be a good chairman and a good senator. So once again, let me thank all of you for what you're doing. Let me wish everybody a wonderful holiday season and a great new year. And as this new legislative session progresses, I look forward to your support as we stand up and fight to make sure that working families in this country can live with the kind of dignity and security that they are entitled to. So thank you all very much.